What a thrilling opportunity to bring you impact stories of gifts and talents you have shared with the church worldwide. Your steadfast commitment to the birthday and thank offerings has over the years enabled our global partners to improve living conditions in their communities. Since 1988, grants awarded to projects in Sub-Saharan Africa alone have accumulated to nearly $5.5 million. This does not even include the $2 million in birthday offering grants awarded before, nor any earlier thank offering grants. To celebrate this global outreach by Presbyterian Women in the U.S. and your partnership with our Africa area team, please enjoy this whirlwind tour across Sub-Saharan Africa of grant recipients from the past 10 years.
In rural Rwanda, young children leave their families to seek better living conditions in larger towns. To help reverse this trend in Bubazi village, the Women's Desk of the Presbyterian Church of Rwanda revived a once thriving fruit processing unit of its Widows Association that had fallen in disrepair in the aftermath of the 1994 genocide. Nowadays organized as a cooperative within the local congregation, 16 women, 12 men and 3 youths produce 2,000 bottles of 500 milliliter pineapple juice a month, besides special orders for weddings, parties and meetings. The improved household finances allow these families to stay together and ensure the schooling and other needs of their children. Having trained 50 of their members as community health workers, the Women's Association of the Reformed Presbyterian Church in Equatorial Guinea built 3 rural clinics in underserved areas, leased those to doctors for health services, and with a monthly rent supported residents of a leprosy center. The health centers will soon reopen now that a divisive church conflict has been resolved. As the cultural context has been stifling the nurture of women leadership in the evangelical church in Niger, the Ernst Women's Association held a consultation for 22 women leaders from 6 regions across Niger. During a 3-day workshop, they learned about organizational processes and leadership roles from the denominational to the congregational level. A milestone was the development of their operations manual and a 3-year action plan. The resulting increase in the vitality of local women's groups has been palpable during the association's annual conventions, which are an opportunity for collective edification and celebration of sisterhood that culminates in a joyful offering for rural evangelist families. To strengthen household finances, the Presbyterian Church in Congo launched a community-based savings and loans program for women. By paying weekly shares, women's groups cooperatively build capital from which members can take low-interest loans. Each share is stamped into personal checkbooks so illiterate women can keep track of their personal accounts. Loans and savings associations have multiplied from 5 to 24 groups. Membership grew from 114 to 750 women, and the gross annual loan fund increased from about $850 to $36,000, despite a 50% devaluation of the local currency. Impact on members' households is measured in the percentage of grass roofs replaced by tin sheets, school-aged children attending class, daily meals fed to the children, and animal breeding activities. Female students at Nile Theological College with no relatives in Khartoum could not have attended the college without its women's dorm. Last year, February, these young women still reported they felt safe living on the school grounds, but in the eruption of deadly conflict in Khartoum a few months later, the institution was attacked and looted. As many have fled away, there is no recent update on the status of the institution and its people. The Church of Central Africa Presbyterian Harare Synod envisioned drilling a borehole in each of its 4 presbyteries. 3 of these are providing clean drinking water, reducing waterborne diseases and cutting down long distances for women fetching water. It also enables congregations to grow gardens. One of them has opened a child nutrition program, feeding 66 orphan children 1 hot meal a day. Proceeds from church gardens have helped build a preschool, pay for church operations, and start up income-generating activities. The 4th borehole failed due to the low water table. 400 women from 12 Presbyterian congregations in rural Pachala undertook an ambitious farm project to fight off malnutrition in this conflict-prone and aid-dependent area of South Sudan. The women secured a large piece of land from the local ruler, cleared the terrain, and provided training tools and agricultural inputs to start planting crops. An additional demonstration farm at the Presbyterian school in town allows students to learn farming and getting along with their peers. The project was disrupted by COVID, floods, and renewed violence, but the women are not deterred. Working together gives them a sense of hope, peace, and unity, they say, and activities like weeding help reduce their trauma. The women continue planting while awaiting the arrival of a new tractor the local government granted them for their farm. The understaffed maternity ward with a 2-bed delivery room at the Tsemeni Medical Clinic of the Evangelical Presbyterian Church of Ghana was replaced with an adequately equipped 20-bed facility that provides services for women within a 90-mile radius. The old ward served about 1,600 women a year, but the health of new mothers and their babies was compromised as they recuperated together in one cramped room. The new maternity ward was opened just 2 months ago and will reduce infant mortality, lower obstetrical complications, and attract medical specialists to offer their expertise. For long-term sustainability, the clinic is overseen by the church while operational expenses are supported by the Ghana Ministry of Health. To address the critical need for safe and reliable blood supplies, the Presbyterian Church in Cameroon started a blood bank at the Presbyterian Health Complex in Douala with basic facilities and a small team of healthcare professionals. Initial efforts focused on raising awareness about the importance of blood donations, creating a reliable network of blood donors, and establishing a blood supply that suffices even in case of large-scale emergencies. Because of the positive outcomes, subsequent blood banks have been established in Presbyterian health facilities in 3 other provinces. Without a functioning city water system, PAC's clinic used to capture rainwater or buy water by the barrel for $20 a day, but it has now its own water source. PAC's is primarily known for its perinatal care, and having clean water in ample supply is a must. The clinic located groundwater on its property, made a drill hole, installed the pumping system, added a second 1,320-gallon water cistern on the clinic's roof, and hooked up its generator to power the pump. Having running water helps improve hygienic conditions in the wards and the operation theatre and keep the laboratory equipment and supplies clean. The sale of well water to the local population further helps pay for the generator's fuel. Church partners in Madagascar initiated a campaign to break taboos on domestic violence and harmful cultural practices that are at the basis of internal migration patterns, where young girls and women end up economically and sexually exploited or trapped in human trafficking schemes as domestic workers abroad. 7 regional synod meetings and a national youth assembly served as a launching point to raise awareness about these issues, and in each synod, a team of pastors, deacons, and evangelists has been put in place to further spread the word. Besides, custom officials and border police at departure ports on trafficking routes are urged to better scrutinize passengers and identify clandestine travelers. Jidada Theological College in Dembidolo used to graduate less than a handful of women per year, but their enrollment surged when the school's diploma courses evolved into a 4-year degree program. Those needing lodging lived 6 or 7 in a dorm room, sharing all facilities with the male students. The construction of a 6-room women's dormitory changed this situation. 22 female theology students are currently enrolled, and the number of interested women is increasing, though culture and finances remain barriers for Ethiopian women to pursue higher education. For over 9 years, Presbyterian women in the Synod of West Kinshasa have held offerings to build their women's center for conferences, trainings, and lodging of guests. With the additional support, they finished the center and purchased the materials necessary to teach women skills in fabric dyeing, cooking and baking, and beadwork. By using social media to promote their products, several of them have now successful businesses to better meet their families' needs. Aspiring female students at Chasevu Theological College have had to find their own lodging. As a result, very few women chose to attend the college. The subsequent lack of trained women leaders has hampered the development of the church. A new 17-room female hostel with a capacity of up to 68 students has allowed the college to start a 2-year Certificate of Women's Ministry program, which will significantly increase the representation of women leaders in the church and inspire others to also seek training at Chasevu College. For kindergarten students at Berhane Elementary School of the Presbyterian Church in Dembidolo, the local chapel has been their classroom. To stay open, however, the government required them to have their own space, so the Synod made additional church land available, the local community gathered a significant contribution, and the school applied for a grant to build 2 blocks of 4 rooms each, one for classrooms and the other for administrative offices, a staff room, cafeteria, and storage space. The entire community is excited to have a conducive learning environment with proper infrastructures and a safe school compound for the little ones. Without public transportation available, people in the rural community of Farasa walk or bicycle 6 to 10 miles to get to the nearest by health post, and pregnant women need to go even farther for a safe delivery of their babies. The long distances keep them from seeking help early, which contributes to higher mortality and morbidity in women and children under 5. The CCAP is finalizing the establishment of a health center with the construction of 3 staff houses. The clinic has a catchment area of over 13,000 people who are eagerly waiting for its official opening. By moving away from brick-and-mortar children's centers for the protection of unhoused children to social safety nets with local congregations as focal point, the Presbyterian Church in Congo models an effective and sustainable child protection ministry for denominations across Africa. Care is offered by host families and prevention of abuse promoted by congregational committees. By the end of this year, 9 of CPC's 13 synods in Greater Kasai will have been trained with 575 congregations participating. In the first 3 years, 112 out of 176 retrieved children were reunited with traced-back relatives after an average stay of just 6 months in host families. May this glimpse at partner projects accomplished with your generous gifts convey the profound sense of gratitude of PCUSA's global partners and our Africa area team for the faithful support from Presbyterian women.